I'm sure you guys know who Parkview is and everything, community. What are your guys' jobs? Can we just go around and you guys just tell me like what your job is here at Townhouse or?
What?
Yeah.
CNA.
You're CNA.
Almost.
Almost CNA. A nurse. CNA. Nurse. CNA. How about you?
I'm a
CNA. Perfect timing.
Crap.
Here's a sign-in sheet too. You guys can do it now or later. So most of you guys are involved in patient care in some way. And so the idea here is, yeah, you guys can go ahead.
Faxed you a copy too.
Judy's a nurse. Yeah. Thanks. So obviously you guys all work in some sort of patient care capacity. So you're on, what's that? So you guys are familiar with hospice. You've seen some of the patients on hospice at your facility, or at least you've heard of them being on hospice. Is there anybody who's never like taken care of a hospice patient or in some way involved in that? Everybody has. Okay, good. So there are other agencies, obviously, that Townhouse partners with that handle the hospice service. But we're going to kind of walk through what the hospice service looks like. So everybody is kind of familiar and more familiar and kind of have like a refresher for those of you who've heard of it, and you can kind of see Parkview's perspective on hospice. So we're just going to kind of walk through this, and I want to kind of dialogue with you guys a little bit, so I may be asking some questions and you guys can kind of chime in or answer whatever you guys want to say, and hopefully we can get kind of a better understanding of how to take care of a patient who's on hospice. So if I were to just kind of say, what is hospice to you guys? What are some basic descriptions of like what you would say hospice is?
End of life.
I'm sorry, go ahead. Comfort care.
End of life.
End of life care. Okay. Anybody else? Yeah, those are two great examples of what hospice can be about. One of the big things that we do is we take care of somebody who has a terminal illness. So when I say terminal illness, I don't mean somebody who has a cold or something like that, but somebody who has an illness that they're dying from. So cancers or some types of other illnesses like Lou Gehrig's disease and things like that can be terminal diagnoses. So in order to be on hospice, you have to have a terminal diagnosis. A doctor has to be able to certify you as having a terminal diagnosis. So if you are 100 years old and you don't have a terminal diagnosis, but you're just kind of dying of old age, you probably won't qualify for hospice. Right now, we're getting better at finding different ways of kind of getting people on hospice, becoming a more sought-after service. So that's a good thing because hospice can be a very beneficial thing for the family and for the patient. So we'll kind of walk through how that can be beneficial for them. The first one that we talk about here is, it says true or false, death is physical, psychosocial, and spiritual event. So we obviously all know that death is a physical experience. Your body ceases to be alive anymore and function. But when I say psychosocial, what do you guys know what that means? If you were to say how you would define psychosocial? Anybody? Yes. So what that's going to basically entail is working through like the emotions and the thought processes of what dying is all about. You're not talking about somebody who dies from a car crash and they don't think about it and it just happens. You're talking about somebody who knows they're going to end up passing away from this illness, and so they have a lot of thoughts. They have a lot of emotions going on. They've got a lot of things internally that they're kind of working through. That's what we call psychosocial. You know, part of what makes us a person. When I say spiritual, what does that mean to you guys? Spiritual. Yeah. Okay. Yeah. So their faith or what they believe in terms of outside of the physical realm, you know, why they believe they're here. And so we at Hospice, want to make sure that that part of things, that part of their life is taken care of and at least given an opportunity to kind of express itself and learn. So obviously when people get to the point of end of life, they're asking all kinds of questions about where am I going after this and what was life all about, and they're kind of reflecting on these things. And so the spiritual aspect of things can be, in terms of all three of these things, one of the more, I guess, profound in the sense that that's really what they're focused on. They know that their body is passing away. They're dealing with that from an emotional level, but also they're really focusing on where they're going to be going and what they really truly believe. So we have people like chaplains. When I say chaplain, you guys know what I'm talking about. Chaplains that will come to your facility here and kind of work with the patient as well as with the families of the patient to kind of help them along in this process. We have social workers that come and help with the psychosocial part of it, so they're going to work with the emotions and kind of more the mental part of that. And then we have the physical part, so we have the comfort care, we have things like that where the doctor is going to oversee how the patient is being taken care of with dignity so that they're dying not so much in agonizing pain or things like that from their illness, but they're dying comfortably and peacefully here at your facility. Number two, the goals of hospice are symptom control, pain management, emotional, spiritual support. So this is kind of a little more of the same of what we were just kind of talking about. But I want to talk for a second about the symptom control. Let me ask this question. This isn't on the test. So true or false? If I have a terminal illness, okay, so I've been diagnosed with cancer, stage 4. I'm, looking like it's probably going to be the end and everything. What if and I get on hospice, what if I choose that I want to do some chemotherapy? Do I still qualify for hospice?
No.
No. Right. So being on hospice means that you've chosen not to go after treatment any longer. Okay, so you've chosen to say, I'm going to embrace this, I'm going to just kind of function without doing the treatment. If a person chooses to not be, or to not do the treatment any longer, or if they choose to do treatment, they can go right back on hospice if they choose to, what's called revocate it. So if they choose to say, well, I want to do some more treatment, like chemotherapies or radiation therapies or things like that, they can revocate their hospice, and then as soon as they're done with the treatment, they can go right back on it. Okay, so you may see that with some of the patients here where there may come a day where they have that terminal illness, they're on hospice, but the family collectively decides with the patient, we want to keep doing some treatment. It's very common for hospice patients, once they start getting that symptom control, they actually start doing better. And so it kind of can be tricky, in the sense that they now will say, well, maybe I can start doing some treatment, and we're all for that. It's not a matter of, an issue for us. We can have them take it off and then put it right back on. So we just want what's best for the patient, and as you guys do too. And so whether they choose to go beyond hospice or choose to revocate it doesn't make a difference to us. We're very versatile in that. That's what's nice about the service. The third one is covered items under the Hospice Medicare benefit and Hospice Medicaid benefit are medications for pain and symptom management, durable medical equipment, and supplies for comfort measures. So your facility is going to have much of the DME items that are already needed, but if there are additional ones, we can provide them. So there's going to be some things that your facility doesn't have that we can get. So we partner with medical supply agencies and stuff that can supply those medical needs for the patient if they need those. 4, true or false, trained volunteers are a required and important part of hospice program. That's true. Hospice, in addition to having somebody like a social worker or a therapist, you also have a chaplain, you also have a doctor overseeing you, but you also have, and your family has, volunteers, sometimes numerous volunteers. Our volunteers do everything from coming and just sitting with the patient and just listening to them or talking to them or reading to them, to mowing the grass of a patient's family that needs that kind of help. So our volunteers are really special people, and it's amazing how many volunteers we get at our agency who want to give back to help people that are going through the loss of a loved one. Many of our volunteers are people that have lost somebody themselves, and they've had a hospice. Maybe they used hospice for their loved one, and they decided that they want to help out and give back. And so it's really a really neat experience. And so if you ever get a chance to do that, or if you're ever interested in volunteering, you can always contact me, and we can get you signed up for that. Number 5, according to Medicare regulations, under the hospice Medicare benefit, bereavement care and services to the survivors are mandated for 13 months. Now, when it says mandated, it's not meaning that it's mandatory. It means that it's available to the patient and their family for up to 13 months after the patient passes away. So we have people at the hospitals over at PRMC and Parkview Randalia and the other Parkview hospitals that go on hospice for a day or two, and then they pass away, but we still provide bereavement for their families for up to 13 months after that. So we're contacting them sometimes on a weekly basis. We'll set up times for them to come in for therapy and things like that with our social team for up to 13 months, and this benefit covers that. So if you think in terms of you lose a loved one, it's not something that, as you guys have seen, with your patients you take care of, you don't just get over it right away. It's a process, and so having a team of people around you that can help you with that process is very beneficial. And like I said, we provide that up to 13 months. Number 6, patients with non-cancer diagnosis may be eligible for hospice care if authorized by their attending physician and approved by the hospice medical director, such as end-stage heart, renal disease, ALS. So when you're on hospice, you have 2 doctors overseeing you. One, you have what's called an attending physician. A lot of times, whoever your medical director is here at Townhouse, who is it? Dr. Wilkins, okay, that he'll be the attending physician of the person who's on hospice here. Okay, that means he's going to directly oversee what kind of care is being given to the patient, what kind of medications are being distributed, and things like that. Then you have our hospice medical director who's going to oversee our nurses and how we're dispensing those medicines and things like that. So they have 2 doctors kind of overseeing, kind of working together to make sure the patient's getting the type of care that they need. So it's kind of a cool thing. Kind of 2-for-1 deal sort of thing. Number 7, true or false, respite care may be offered for 5 days to stabilize the caregiver physically and emotionally. What is respite care? Anybody know? How would you describe respite care?
Give the family a break.
Very good, yeah. So every hospice patient has to have what's called a caregiver. Does everybody know what a caregiver is? When I say caregiver? Okay, so if I'm the caregiver, that means I'm taking primary responsibility for making sure the patient is washed and clean and getting their meds the way they need to and helping them up and things like that. That's what a caregiver is. And so you guys at the agency here, the nursing home, function as a caregiver. So if you picture a hospice patient being taken care of in the home, and let's say the patient's wife or husband is the caregiver of that patient, okay, you guys are that caregiver. Okay, so we as a hospice agency are to treat you guys the same way we would treat that patient's family member or whoever is being the caregiver for that patient. So respite care is time for the caregiver to have kind of a break for taking care of the patient. A lot of times caregiving can be a very strenuous, difficult task when you're caring for somebody who needs that constant attention. And so we have the ability to have the person placed, possibly if they're in home, we'll place them in a nursing home possibly or something for up to 5 days to allow the caregiver to have some rest. And Medicare benefit pays for that. Now, I know what you're thinking. Hey, can we have a respite care, right, for taking care of patients? It unfortunately doesn't work like that, but that's what respite care. You guys probably get sometimes patients that are maybe on respite care. Yeah. Okay, number 8. The patient has the right to discontinue hospice care should further treatment for their terminal illness be desired. So we already kind of covered